Today, we focus on several concerning developments: the resurgence of avian influenza strains, the spread of chronic wasting disease among wildlife, the emergence of the Oropouche virus, and a significant uptick in measles cases. The United States has reported its first outbreak of the H7N9 bird flu strain since 2017. Detected on a poultry farm in Noxubee, Mississippi, the outbreak affected over 47,000 broiler breeder chickens. The area has been quarantined, and the flock depopulated to prevent further spread. While human transmission of H7N9 is rare, the virus has a high mortality rate among those infected, with 616 fatalities out of 1,568 cases globally since its detection in 2013. New York Post +1 Reuters +1 simultaneously. The H5N1 strain of avian influenza is evolving in unprecedented ways, showing adaptations to mammals. This development raises concerns about potential human transmission. The current outbreak in the U.S. has persisted for over 2 years, with increasing cases among agricultural workers. Experts emphasize the importance of heightened surveillance, improved biosecurity measures on farms, and considering poultry vaccination to mitigate risks. Chronic wasting disease, CWD, a neurodegenerative disorder affecting deer, elk, moose, and reindeer, is rapidly spreading across the United States. First identified in free-ranging deer in Colorado and Wyoming in 1981, CWD is now present in 36 U.S. states, parts of Canada, Scandinavia, and South Korea. There is no vaccine or treatment for this disease, which poses significant threats to wildlife populations and raises concerns about potential spillover to humans, particularly through the consumption of infected venison. Scientists urge improved surveillance, research, and wildlife management practices to mitigate the spread of CWD. Health experts are cautioning travelers about the Oropouche virus, an emerging tropical disease that has recently infected travelers returning to the US and Canada from countries including Bolivia, Brazil, Colombia, Cuba, and Peru. The virus is primarily transmitted through bites from midges and certain mosquitoes. Since its discovery in 1955, there have been 500,000 known cases, mainly around the Amazon basin. However, since late 2023, the virus has spread to new regions in South America and the Caribbean. In the U.S., 109 cases have been identified across 7 states, with Florida reporting the highest number of infections. Symptoms mimic other tropical diseases and can range from fever and headaches to severe conditions like brain swelling and Guillain-Barré syndrome. Pregnant women face heightened risks, including stillbirths and miscarriages. There is no specific treatment or vaccine, and prevention relies on minimizing exposure to insect bites. Measles cases in Europe and Central Asia have reached a 25-year high, prompting health officials to urge vaccination and awareness of symptoms. The highly contagious disease has seen a dramatic rise, with over 127,350 cases reported in the WHO's European region in 2024, up from 4,400 in 2016. Measles symptoms typically begin a week after infection, resembling a cold with fever, cough, runny nose, and red eyes. Koplik spots appear inside the mouth around days 9-10, followed by the characteristic red rash on days 10-12, starting on the face and spreading downwards. Complications such as diarrhea, eye infections, and pneumonia can occur, particularly in infants, pregnant women, and those with weakened immune systems. Vaccination with the MMR vaccine remains the most effective prevention method. Health experts warn against vaccine hesitancy and emphasize the vaccine's safety and essential role in preventing potentially severe complications. Parents are advised to ensure their children receive both doses of the MMR vaccine to prevent further outbreaks. The emergence and resurgence of these viruses highlight the importance of global vigilance, robust public health infrastructure, and proactive measures to prevent widespread outbreaks. Individuals are encouraged to stay informed, practice recommended preventive measures, and consult healthcare professionals when necessary. Public health authorities continue to monitor these situations closely and are working diligently to mitigate risks and protect communities worldwide. Thank you for joining us for this health update. Stay safe and informed.